So hey guys, it's Tamara. Thank you so much for coming back to my channel. Welcome. Today we're going to talk about dissociative identity disorder. I've had so many requests for this video, and I recently had a question about switching. So we're going to talk about that. We're going to tackle it in today's video before we move on to some of our other topics. So thank you so much for coming back to my channel. For those who are subscribed, and for those who are new, I encourage you to hit the subscribe button over here so that you can stick around with us and continue to grow and learn. So let me go ahead and just get started. Let's just jump into this, okay? So dissociative identity disorder is known as multiple personality disorder. A lot of older generations know about multiple personality disorder. The more modern generations, or people who have more clinical knowledge, they recognize that the term has been changed from multiple personalities to dissociative identity disorder. Now, there is what I like to call a spectrum of dissociation. And what I mean by that is that you have individuals who dissociate for a brief period of time. That's more normative dissociation, okay? That's like daydreaming. Then we have somebody who has more moderate dissociation. And that may be more like passing out or zoning out when angry or blacking out. You may hear certain people say, you know, I'm blacking out. I'm not here when I get angry, when I do certain things that makes me angry. And then we also have really severe dissociation, which is over on this side of the spectrum. And that's what would be known as a dissociative disorder. And under that heading of dissociative disorder is dissociative identity disorder. All right. So DID is a process. It's a process of extreme or severe dissociation into different components of yourself, right? It's like having multiple compartments or multiple doors or channels within yourself. And depending on the situation, that individual steps forward. Now, I'm not an expert on dissociative identity disorder, but I am an expert on trauma. So I do know a little bit about how this works. And for the most part, the other part of that person, or that second or third personality, however many personalities that there are, that person peeks through when the actual person, the victim, the patient, the client, whatever you want to call them, is experiencing a dissociative episode. Okay, usually dissociative episodes come about when the person is stressed and overwhelmed, when they're feeling defensive or threatened, or when there's some kind of reminder or flashback of a traumatic event. Then you will see that person step forward. I had one particular case that happened to me so many years ago. I was just starting out in the field, and I think that this case was pretty authentic when it came to dissociative identity disorder. And the individual would really switch in tone. They would switch in facial structure, and eye contact was different. They would change in the way that they would react or respond to me. They had different likes and dislikes. There was really a different presence in the room. And I had no idea that this person was seriously dissociating and had a dissociative identity disorder. I really did think it was a charade at first, but the person's abuse had been so traumatizing and severe, and every part of that person met the criteria of dissociative identity disorder so much that the psychiatrist I was working under at the time said, you know what, I think we're dealing with a case of DID. And really, I had maybe 2 experiences in a session alone with that person where I really did feel a switch. And that's the best way I can put it. It was an instant switch, right? People who are not familiar with DID feel like, well, there's probably going to be some recognition of the person changing, right? You're going to notice a change in attitude or a change in appearance, or something is going to tell you that they're changed. And that's not really the case. It's really hard sometimes to tell that the person has switched. The only way that I knew that the person had switched is the presence in the room was different. The presence in the room was different. The attitude was different. The level of confidence was different, right? This person had an arrogance about them, had a very narcissistic attitude, was very self-assured. Also, a British accent came about as well, and it was not a put on. It was a pretty good British accent. I would ask this person questions about their past or things that happened, and they would look at me like I'm crazy, like they couldn't remember. And it was really like, you know, my actual client transitioned from being my client to being a complete stranger. It was so interesting and also frightening at the same time. I don't even think I slept in like that entire month that I was meeting with that individual, because the presence in the room was so different. The attitude was so different. The likes and the dislikes, the personality, the voice, all of it, the facial expressions, the eye contact that they held with me was so different. It's really kind of scary. You know, I think YouTube and pop psychology does a real injustice to this kind of topic, and here's why. You know, it's really fun to utilize this topic as an educational piece for some people. It's also really interesting to watch some of the YouTubers. I mean, I'm certainly not talking down about them, but it's interesting to watch some of the YouTubers talk about it like it's this fun experience, and it isn't, right? There's a lot of trauma and abuse that goes along with DID. And I really do firmly believe that it's rare. And I also believe that only a few cases come through or peek through in clinical settings. We also have pop psychology on YouTube really making it like this fun, interesting experiment that's like really cool. Everybody should get to know it. And that's not the case. DID can be very traumatizing to the clinician. It can be very traumatizing to family, to spouses, and it can be very scary to the person experiencing it, okay? I think the closest case to a true situation of DID would be the movie The Three Faces of Eve. I think that clinically that's an interesting depiction, but it's also a very clear depiction of what it's like, okay? Sybil is another one. You're going to get a little bit of more reality of what it looks like in terms of, you know, Sybil's anxiety when it was happening, Sybil's fear when it was happening, the psychiatrist being really perplexed. Those are the real pieces of the disorder. It's not this real interesting, fun thing that's really cool, all right? So thank you so much for being with me today, guys. I encourage you to give it a thumbs up if it was helpful to you. Let me know what your questions are and your concerns in the comment section below. I will put some information in the description box that's going to talk about switching. So stay tuned for that, because somebody had a specific question about that. All right, I'll see you pretty soon. Bye. So hey guys, you probably thought that I forgot to mention switching, and guess what? I did not. I actually got a question a couple weeks ago about the process of switching, and I want to thank my YouTube subscriber for bringing this up because it's a very important topic. So what's the process of switching? Well, switching is the process by which a different personality that lives within you begins to emerge. And the emergence of this personality is often triggered by a strong emotion. It's often triggered by some kind of a reminder, some strong emotion, a strong event that has influenced the person in some way. The switching process is not manual, okay? It's not manual. It's not something that you can say, okay, you know what, I think I'll switch into this person. So I'm going to do that because this is the easier way to deal with life. That is not the case. Switching is an emotional process. It's not a logical one. And it usually comes about when the individual is feeling threatened or defensive or overwhelmed in some way. All right. So the switching process is when another personality that lives within that person begins to emerge. And that emergence is often triggered by a strong emotion, a strong event, or something of the kind, right? There's some kind of emotion doing the work, for lack of a better word, okay? So the switching process, unfortunately, is not as interesting as YouTube would like it to be. There are a lot of people who are on YouTube saying things like, you know, I can switch when I want, or I could be this personality when I want, and that's just not how it is, okay? That's not true, guys. The truth of the matter is this, that it's an automatic process that cannot be controlled, okay? So thank you so much once again for watching this video today, and I'll see you guys on Monday with a new one. Bye-bye.